Yeah, so my name is Brown Kanyangi, and I'm based in Nairobi, Kenya, but I've been working for agencies across several countries, mainly for Save the Children, International Rescue Committee, UNICEF, and UNRWA as well. And also some national agencies here in Kenya have done some, short-term consultancy work. And I'm here to just share my experiences of what it takes to be frontline worker, a supervisor, coordinator, and a manager, because I've been very lucky to, have participated in all these roles.
Okay, wonderful. And thank you, Brown, for joining us. So I'm going to leave it to you to decide where to start, where to begin. And if it's okay, if I have a few clarifying questions, I'll jump in and ask you. But I'm going to hand it to you, and you decide where to begin and what do you think is important for the public to know about child protection, specific to your experience.
Yeah.
It sounds like in several countries within Africa.
Yeah, mainly, yeah. So just to respond to your question, I mean, this is a very interesting topic. And as I said, child protection is very, very important. And we all know it is our responsibility. So not only frontline workers, but it's the responsibility of everyone to do child protection. But I think maybe I can start from the challenges on the understanding aspect. So first, defining child protection is a challenge in itself, because if you ask 3 or 4 different people what is child protection, you're likely to receive, different responses. And I've seen this in countries where I've worked. As I mentioned, my area of expertise is child protection case management, and also information management. And we've been trying to digitize how we collect information on casework to make sure, the process is digitized and, information is readily available to supervisors and managers. So very lucky to have had this wider experience in, responding to child protection issues. So as I mentioned, the first challenge is defining child protection. So first, as I mentioned, if you look at the social work curriculum in many African countries, I mean, I don't know about the Western countries, but, I'm speaking from my interaction with frontline workers. Social workers who have qualification in social work still don't understand what's child protection. And you find they're looking at sick children. So you look at the documentation. They bring in a sick child, a child without identification. And I think the challenge is relating all these issues to the basic definition. Okay, I think that's where we have a gap. And I think the social work curriculum does not cover child protection adequately. And therefore, first, without understanding the definition of child protection, it means even the response will not really be very effective, because we end up taking on cases that are not really child protection cases. And you imagine if we have to document sick children, how many children will end up on the case management register? I mean, we most likely will have thousands of children, and the resources are very limited. So I think understanding the definition of child protection is a gap. And then I think another issue is around supervision. I think, honestly speaking, frontline workers are not properly supported. And it's because the definition of supervision, I think it's not well articulated in many agencies. So you find many agencies see supervision like, how many cases have you done? What is your target for this week? Why have you not done A, B, C, D? But we all know that supervision goes beyond, oversight. The support aspect. Okay, so that is coaching and mentorship on the job. I think that's something that is not properly defined. Okay, how do you mentor case workers? How can you review case files to understand where the gaps are? I think that's an aspect that needs to be strengthened. And then the other issue is around, as I mentioned, support, psychosocial support. So social workers are often overwhelmed because, again, this goes back to donor requirements. Indicators, we are reporting against US aid indicators, for example, where we are looking at numbers rather than, quality. And you see, if we are not able to meet the target, then there are audit issues, there are audit queries. Why are we behind schedule? So most social workers get overwhelmed trying to meet the demands of donor reporting, and you find the quality of casework is not really great, because again, the people who set up these indicators don't really understand the whole aspect of case management or responding to working with children. Okay, they see numbers as a better way of measuring achievements. Yet, in my own opinion, that's not really the best approach. So, caseworkers get overwhelmed, and then they don't receive really support. They are always under pressure to get things done. Okay, and especially now, when we've introduced the digitization of case management, it also creates an additional barrier, an additional workload, because now they have to key in all the information. Sometimes they might have less computer skills or limited computer skills. So it takes time to, get used. I mean, I've seen countries where this has really, really worked well, where the digitization aspect of child protection has really worked well. But in other contexts, it could create, an additional barrier, an additional workload, because social workers, struggle to use these tools. So again, that is one of the challenges we have. And then the other big challenge is the organization culture. So you find the way agencies are structured determine the morale, the support, the sustainability. So most child protection agencies in Africa, especially, where government has a very limited capacity. Most governments in Africa, have very limited capacity, and agencies kind of do the bulk of case work. So in this case, you find the agencies rely on donor funding, and contracts are very short, 6 months, because that's what the donor has committed to. So number one, to do proper interventions, we can't assume that it's going to take 6 months. But now the donor funding is only available for 6 months. So sometimes the whole response is rushed to meet the donor requirement. And then find the quality is important. And also staff morale, staff being on temporary contracts, it leads to high turnover. So, agent, you're not sure whether your contract will be extended because the funding is scheduled to end, in June, for example. You find this leads to high turnover, high staff turnover. And high staff turnover has implications. We all know from the social work perspective, social workers need to create a personal relationship with children. They need to build that trust. And if you are having a new staff every 3 months, then we are unlikely to achieve good results. So there are quite a number of challenges, from the perspectives of case workers, from the perspective of managers. There are also challenges. The managers have their own expectations. They want to see numbers. They want to see the work being done. They want to see the donor reporting completed in time. They want to see, things working. And sometimes the focus is on results rather than what needs to be done. The frontline workers. And I think that's where we have a gap, where the understanding of supervision within agencies is limited to, day-to-day oversight rather than, capacity building, one-on-one coaching, mentorship, dealing with burnout, and providing, self-care, trying to understand, why things are not working. So I think that's an aspect that requires improvement in many, many agencies. And then the top management, very few people don't really know even what's child protection. I remember in Sierra Leone, a person, I think from one of the districts, came in and said, "Oh, I have a very sick child, I need support." And the country director referred that case to protection division. And then my chief had to intervene and said, "Sorry, we can't intervene because a child being sick is not necessarily a child protection issue unless there's evidence or risk of abuse, neglect, and exploitation." And also in a country where resources are limited, it is important to prioritize, cases. So obviously, this person wasn't very happy, felt let down, but that's a reality. So top management also don't really understand what child protection do, especially on leave alone the response aspect, that's case management. When we look at the prevention programs, the awareness programs, which are very, very important, sometimes the results are not tangible. Okay? Like if I say we had awareness sessions with 20 parents or 30 parents, it becomes difficult to see the tangible results. Okay, I think managers are more important on number of children rather than looking at other thematic areas, because we have awareness raising, prevention, training of foster care parents, training of kinship care, even awareness sessions among children. So those programs are kind of not given the necessary relevance. So those are some of the aspects. And I think what needs to be done, in my opinion, is everyone should be trained on child protection, the basic principles of child protection.
Brown, can you then provide your best definition of child protection as you see it? How would you define it?
How to define child protection? One, prevention and responding to child abuse, neglect, and exploitation. Now, I also have a problem. You see, that is the standard definition. But from my experience, I also have a problem with that because, I mean, abuse is very easy to define. Exploitation is very easy to define, but neglect is very difficult to define, especially in African context, where your perspective of neglect, because you live in a Western country where you have better health care, you have better education, you have better services. So your perspective of neglect and my perspective of neglect, sometimes they may not be the same. So child neglect is very difficult to define. And I think that's also where we've had problems because it's difficult to define, it's difficult to measure, and different practitioners have different perspectives about child neglect. So while that's the standard definition, I think it should also be contextualized. And you see, unfortunately, many of these standards are Western standards.
You mean locally? The staff take on Western standards of definitions for neglect?
Well, overall in child protection, a lot of systems and standards are normally from the UK, Canada, the US.
Understood.
In many English-speaking countries. So I think some of this should be contextualized because, for example, we have many poor people in Kenya. They are poor, but they don't abuse their children. So their children may not have access to the good education standards. They may not have access to good healthcare services, but that does not necessarily mean these kids are neglected. They're not neglected parents. So poverty and neglect is also very, from the African context, is very controversial.
Can you give us a sense, maybe grounded in the reality of, well, if you have a Western standard for the definition of neglect, and I'm assuming that you find that in training materials, or as you say, you have donors and they might impose definitions. So in your context, one, what would constitute neglect in Kenya? Because I could tell you the argument you just posed is the same here, because neglect in the Western context here in Canada, it's depends on your upbringing. It's for some it's morally based around their beliefs, but it's also upbringing, and even here people run into challenges of what is neglect. But I'm curious, in your context, what is neglect?
Now, you're right. If we were to apply the official definition, then probably 70% of all children in Kenya would meet the threshold for that definition of neglect, because they will say, well, I was sick and my parents were not able to afford, they were not able to send me to a hospital. So instead, they gave me herbal medication. So if we were to base that on Western definitions, then definitely that case could meet the standard definition. However, I think we could, in African context, that should be limited to extreme cases of neglect. So for example, abandoned children, okay? And then probably, let me see another example, where, children are not able to receive basic needs. So basic needs refer to shelter, food, and maybe schooling, okay? Again, where it becomes complicated, the aspect of poverty. So we have parents who are willing to send kids to school, but then they simply and genuinely do not have the means. So why should we really blame them if it's beyond their means to provide schooling as an essential service? Okay, so the aspect of poverty, yes, these kids would probably, they need support. And I think if a child is not attending school, and if there's a way, agencies can support and make a referral, that would be great. The challenge is also with service provision, which makes even neglect more complicated to deal with. Like in Nigeria, I was there, I think 3 years ago, and there were, I think they had documented around 1.2 million children that were out of school. And many because of neglect and poverty. And my question was then, do we have really, realistically, can we respond? Okay? Because what's the point of having these kids on a case management register when there are no services to respond to the neglect? Yeah. So I think, in my opinion, maybe, and it is unfortunate, but probably we should not intervene if the services are not there.
Okay.
Yeah.
I wrote a few questions down. You've said because you said a lot and quite fascinating, and I want to go back to what you've talked about. And I'll look, Brown. I could tell you that every issue you mentioned is an issue that we have here in the West. Probably at a different level or different intensity, but we're struggling with the same issues of supervision and support for staff and organizational culture and change and so on. I'm curious. You said that you've experienced being a frontline, you've experienced supervising, and you've experienced leadership at a management level. And you talked about how, to me, it sounds as though you were saying leaders who are promoted because you've been frontline and then you moved into supervisor, but they fall into the same culture that as the traditional that has existed where it's not supportive. Can you tell me from your experience, because you've seen it all, why is it that leaders who have been on the receiving end of the hardships, when they become leaders, do not make any changes?
Frankly speaking, let me say, even if today I became a manager, it would be very difficult to make the changes I want to see, because some of these changes require organizational change, which is also very difficult to achieve. Like, for example, having staff on long-term contracts to create job satisfaction, providing an environment where staff can raise issues. Those can be done. But my question is, if you don't have resources also to support the structures needed, like self-care, addressing burnout, high staff turnover, definitely it's linked to resources. So most of these agencies have very limited resources. And the challenge is government bureaucracy is also difficult. I know, like Zimbabwe, the bulk of child protection work is undertaken by the ministry, which is good. But in many, many other countries, even though the ministry is responsible for child welfare, it is their mandate to do the job. But again, the bureaucracy in the government, the rigidity, even how can I put it? People don't want change. People don't want to accept new ways of doing things. So what I can say is, yes, I agree. We have people who become managers and they're unable to fix the problems. But it's also because they have very limited options to do that. I think, in my opinion, child protection should not be funded by donor aid. It should be funded by government budget that is more consistent, it's more reliable, that is more, I would say, forthcoming, because you are guaranteed in the national budget, you're going to have X amount of money allocated to social welfare or child welfare. I think with the way the donor aid is structured, is also responsible to this problem. So I think if we really want to create a change, we must fix how donor aid is structured so that we stop 3 months funding, 6 months funding, and we have long-term funding. Unfortunately, especially in emergencies, like now where we have people fighting, very difficult to find a donor who would commit to a long-term funding of child protection program. But I think if we really want to change, then the change has to come from the top.
So so we might have audience that are watching from the West or locally from Kenya. What can you give us a picture of what's the worst of it all for families and children on the receiving end of service in the Kenyan context? So you talked about a lot of challenges and impact on staff. However, the focus is on welfare of children and families. What would you say is the worst impact as a result of the system, the structure, all of it that you've talked about is on families and children?
I think, again, parents have different expectations and different perspectives, and they also don't understand child protection. So we've had agencies that provide sponsorship programs. I think, frankly speaking, that's what many parents would want to see, where we have a sponsor looking after these children, providing support. But
Brown, sorry to interrupt, but this is important for the West. Are you talking about the programs, for instance, that we see here advertised for someone from the West paying $30 a month to sponsor a child?
Exactly, like Compassion International.
Can you tell us more about that? Because sorry to interrupt, but as you're explaining, can you tell us the impact of that service on locals? Because I wonder if you agree with it or disagree, if you see benefits or it's not a good thing in your opinion.
Okay, I would say, I've seen success stories because I grew up in a village where some families were very poor, and Compassion International did a great job by sponsoring kids, seeing them through school, and they would do family home visits, so they would also address any protection issues coming up. So while sponsorship is not the main objective of child protection, but it has somehow a component of child protection. Now, the problem with that is it also creates inequalities because they would not sponsor the entire family. They would only pick one child from the family. So what happens to the rest of the children? So that's a problem with that model, because now we have one child who will be advantaged over other children. So they have unfair advantage because they're receiving the sponsorship. And then number two, obviously, our focus is on child protection. Yet the sponsorship, goes beyond child protection. It's much broader. Now the question is, of course, as I mentioned, that's what many parents would love to see. Okay, because the understanding of child protection is also very limited. So sometimes they don't even understand the interventions we provide. They don't really understand the benefits because their expectation is material support. Okay. And I think creating awareness on the expectations of caregivers and children should be prioritized so that it's very clear from the beginning what agencies are here to do, the limitations of the support, and the expected outcomes.
Okay. Yeah, thanks for that. Sorry to interrupt, but it's just you raised that question of I have to say, years ago I participated in that program, but at the time not realizing what is the impact that you're having.
Yeah.
So it's fascinating to hear your perspective.
Yeah, I mean, it creates inequalities because if you have a family of 6 children, what happens to the other children?
Yeah.
And then, I mean, it's very controversial, but again, I've seen kids get supported all the way to university, which is great.
Yeah.
Yes.
And so you're giving us excellent perspective, again, specific to your context. If you could please share with us, so bearing in mind all the challenges on staff, frontline staff that you mentioned, can you give us a life in the day of a frontline protection worker in Kenya? Like, what would we see them doing? And what would we see the impact on them? Just like painting a day in the life of a worker.
Yeah. So in many instances, their day starts with meetings. Normally, they have to check into the office for daily meetings, sometimes weekly meetings, and then in many cases they leave the office for field visits, family visits, home visits, and in many cases they come back at around 4 or 5 p.m. and they spend like an hour or so, completing the paperwork, updating the records. I mean, now that it's digitized, they have to synchronize their mobile devices with, the main database. But I remember in Syria, one of the biggest challenge was undertaking home visits. I mean, also agencies don't have resources just to do it. Because some of those families, like in Nigeria is a huge country. A child lives 50 kilometers away. It's just not practical to do those family visits. So they end up, sometimes just making phone calls to families just to check on how things are moving on. We all know that there are limitations to that. But in many cases, yes, they are very committed. They really want to get the job done, but they're also under-resourced and they're often overwhelmed.
So you mentioned also that, and this is where I think I'm hearing as you define social work or social worker in the context of in Nigeria, that in Kenya, it's different than here in Canada, or at least in
Yeah.
Canada, where you have to have a social work degree at least.
Yeah.
So you said basically anyone can be a child protection worker. What are the challenges that you find with that approach, or that kind of reality that if I'm in it, I'm a mathematician, or I'm a whatever. I was an electrician, and now I become what's wrong with that? What's the worst of that?
I think, okay, let me be honest. There's people who have, I mean, most of my colleagues worked together, people with different background qualifications, and they have made great child protection practitioners. So in my opinion, the training received on job training is very, very important. And I think people who are not career social workers have made it, okay? And they have really done a good job. But the challenge with that is the on-job training is not standardized. So that means different agencies would provide different trainings and exposure, and then that could create problems. Okay, so I agree it's very, very important to have the basic qualifications in social work. Unfortunately, many African countries don't consider social work as a very important aspect, so it's not regulated. Okay, I know UNICEF is trying to work with many governments to try and put standards in place. I remember the last time I was in Nigeria, the bill was before Parliament. Okay, the social work framework to regulate social work, but it's still work in progress, and I think honestly it's going to take time to have it properly regulated.
Okay, so I think I'm starting to understand what you're saying.
Yeah,
it's not regulated.
yes,
Meaning it's quite subjective, and
yeah,
each agency delivers child protection in the way they see or define child protection.
yeah.
Are there any government regulations or oversight that provides minimal guidance on standards or at all?
Okay, we do, like in Kenya now. In Kenya, actually, they require you to have some qualifications in either social work or child protection.
Okay.
So we now have that requirement. And then they also, now for you to work with children, you must undergo vetting, reference checks, and criminal background checks. So those standards are in place now. I think the question is, it's left to agencies to process that paperwork. So there's no one really watching or auditing to ensure those standards are adhered to. So I think one of the problems is adherence to standards.
Mm-hmm.
Yes, because we've had great standard operating procedures, okay? But it's, having it as a document is one thing, and making sure those procedures are followed to the letter is another aspect altogether. And that's, I think, where we have gaps in many, many African countries.
Got it. And you talked about culture, which is one of the elements here in the West as well. It's a struggle for child welfare. Culture is you identified as critical to the well-being of staff, which is then critical to the service that they offer and provide families and children. So as a consequence, there's a parallel process. If the culture is healthy, staff can provide better outcomes. What
Yeah.
are the sorts of issues that within your context that the culture, so when you speak of culture, what can you give us a sense of what is the culture that you speak of right now that you're saying is not the ideal? Like what's happening within organizations?
Okay, so for example, if you look at remuneration, salaries, NGOs, especially international NGOs like UNICEF, Save the Children, pay much higher salaries compared to government salaries. So you find actually there is a huge turnout within the government. So, you know, everyone wants a good salary. Okay. So salaries are not standardized. National NGOs pay less. International NGOs pay pretty well. I think government salaries are really, really low. You find because of this, it also leads to high, staff turnover and even motivation. I mean, honestly, this is my own observation. This is my personal observation. Government frontline workers are less motivated because in many places salaries are very, very low. So they might have the knowledge, the skills, but they are simply not motivated to get the job done.
And how does that impact the culture? So you spoke salary, and then you talked about burnout, you talked about a lack of support by management or supervisors, and you mentioned different types of support. There's the coaching, there's the mentoring. So can you give us a bit more on how do all these issues impact the culture?
Okay, so as mentioned, managers, the top management, of course, they're not child protection practitioners. They don't even know what needs to be done to improve the welfare of staff, to address issues of supervision and ensure that the quality of services are good. So you find, because the managers don't have the know-how or understanding of these issues, they really don't address problems when they occur. And when problems occur, if they are not addressed, then what happens? They impact on the services provided to children. So for example, if staff are less motivated because of low salaries, and this is common in government departments, you find they come to work at 9, okay? They leave by 4. They're not motivated to work beyond. And again, I'm not saying all of them. I mean, we've had staff who are very, very dedicated despite low salaries. But in general, if they're not properly motivated, then they're not even motivated to work beyond, official hours. And as you're aware, social work requires sometimes to work beyond official working hours, especially if you're responding to high priority cases. So obviously, if the culture an organization does not see the value in investing in staff, investing in welfare of the staff, addressing issues that come out of supervision, addressing issues that come from day-to-day challenges. If these are not addressed, at the end of the day, the impact on the services provided. So that means follow-up visits will not be done. The quality of documentation is also sometimes very poor. And if you have a very, very poor assessment, means even the response, the case planning aspect will also be very, very poor. And then again, how they address problems with staff. For example, if the staff are making mistakes, how do we address problems? Again, from my experiences, many supervisors don't really take time to do their work. And because the managers don't understand what a supervisor is supposed to do, you find that the supervisors don't do their job well, and it will also impact on the quality of the response.
It's like this vicious cycle. If those who are watching who understand organizations are like they're living organisms, and it's critical that they understand that the structure as a living organism, and the cause and effect, as you're talking about cause and effect, and then consequences and impact. So it sounds, look, you're not, it's quite fascinating that all of the issues you identified are almost identical to what we're struggling here in the West. Yeah, not to the same degree, but we are struggling with those. Go ahead.
I mean, our perception has always been, child protection is better funded in the West. I mean,
funding is better. Yes, funding is better.
Okay, so social workers have vehicles, they can respond. Here we have, maybe one vehicle allocated to child protection.
Wow.
And also, agencies are not, most agencies have different thematic areas. Most agencies will have other programs in addition to child protection. So they have to kind of share resources. It's very difficult. Yeah.
Look, I don't want to minimize your challenges, and I want to clarify. When I say the challenges are similar, it's more around the culture, the impact of the lack of psychological support, emotion, being overwhelmed by work and so on. But you're absolutely right. The staff here are well paid, and they have a lot more resources. So I want to clarify, and you're absolutely right.
Yeah, exactly. And again, back to the issue of training. I think when I've looked at the institutional care systems here, I mean, honestly speaking, they're horrible. And I think that
can you define what is an institutional care in Kenya?
So like an orphanage.
Okay, can you give us because maybe the audience might not know, because here in Canada we don't have orphanages. So what's an orphanage? Describe or give us an idea of what it is.
So an orphanage is a home, an institution where children who either orphans or they lack proper parental care, they're often brought to be cared for. And it is a huge challenge. Although the government has now agreed to invest into family-based care, but it's also a problem because a lot of donor funding has focused on institutional care. Okay, and we've had even volunteers from Canada, the US, the UK coming over to work in this institutional care, and they bring support. But one of my observations is many, and this is an issue of training, and I think, I agree we really need proper training for our frontline workers. Many staff working in this institutional care don't really understand the needs of children. They see material needs as paramount. Yet children, especially young children, are not necessarily interested in material support. What is more important is emotional support. And understanding emotional needs of children, the challenge. It's a big gap. Now there are plans to transition to foster care and kinship care. So kinship care is where children stay with their family members. But the challenge is institutional care is also a money-making entity because of all the donor funding. So there are people who are reluctant to let that go. And then foster care is also a Western concept because in Africa, what has worked well is kinship care, where children are cared for by their relatives and family members. But now foster care is that they are total strangers. So the government is trying to put that in place, but I'm not sure how successful it is. I'm yet to speak to people about it. But the challenge is there's no really proper support from the government. I mean, in the UK, I know foster care parents get paid to provide those services. I'm not sure if that's the same case here. Yeah, I'm yet to to speak to people about this and to see what's working, what's not working. But I know it's going to be a challenge putting that into place.
So now I want to. I'm super curious to hear your position on this. So, what's your advice for Westerners watching this if they're considering, even if it's the head of whatever organization that's providing donor money within Kenya? What's your advice to how would you advise them to support? Their heart is in the right place, but what is the ideal method of supporting child welfare in Kenya?
I think family-based care is the best. Okay, it might have challenges because people are used to institutional care, and now we are transitioning family-based care. I think from research we know institutional care, has many problems, and we've had, documentations where children have been abused. They're overcrowded, and also from research, children in institutional care have poor outcomes in general across several domains, be it education, social networks, ability to build relationships. They're psychologically traumatized because of being brought up in institutional care. So we all agree it's bad for children. I think many donors come to Kenya and they give a lot of money to institutional care. Personally, I have issues with accountability, okay? Because once you give the manager, let's say $10,000, you have no way of following up to ensure that there's value for money. So issues around transparency, accountability. So I think if we have donors who are looking at, supporting family, child welfare systems, foster care and kinship care is the way to go. Now with foster care, I guess a lot of training is needed and supervision because it's a relatively new concept. I mean, it's been there, but it was formalized recently, and there's a lot of work to be done. I mean, my worry is if the government has the capacity to provide oversight, okay, because they're supposed to train foster families, they are supposed to maintain a register of foster care providers and provide the oversight. Now, I don't want to say it's failing because I haven't really followed up on that, but it's something I really want to find out how it's working out. Yeah. But if we are, I think donors should really do more to support kinship care and foster care.
And I don't want to put words in your mouth, but I think I heard you say that overall you would much rather have government in Kenya take responsibility for all of it and not have donor services. You talked about the short-term contracts and how that. So is that accurate that if you had the power to reform child welfare in Kenya, what would it be? What would you do?
No, I think let's agree. Even in England, we still have private agencies supporting the government. But the leadership, the oversight and the leadership really needs to be with the government. I mean, having worked for UNICEF, yes, it has a legal mandate to work with the government, but UNICEF cannot supervise government workers. And some of the challenges I had, for example, in Sierra Leone, is we would have trainings, people don't turn up. Now it becomes very difficult to enforce that because even though I'm seconded to the ministry, but I'm not the ministry staff. At that point, I was a UNICEF staff, so it was very difficult to enforce decisions. And so you find some of the oversight issues come up because the government does not play their role appropriately. And I think supporting the government to really take a lead on this, it's still a challenge. I can tell you it's still a challenge, but I think might take time, but it's what is needed.
Yeah. No, I think I agree. In any situation where you have too many hands in the same pot without oversight is dangerous.
Yeah, because even today, go to many agencies. There's a national standard operating procedure, and then we have each agency with their own procedure, and it's difficult to. The government is not able to really enforce standards.
Yeah, and how fair is it to families who receive services from different organizations? One's going to receive better service or worse service, depending on the organization they're serviced by.
Well, I'm not sure if I am really in a position to give an accurate answer on that. But I think it also comes down to the issue of standards.
Yeah.
Because if one agency is providing a better service and the other one providing a bad service, the government is supposed to have standards. Now, again, this is a challenge. We have so many, like in Kenya, we have so many agencies doing child protection that I'm not sure if the government is even aware of what's happening. I mean, this is my own, it's not the official position, it's just my own observation. So I might be right, I might be wrong, but I think when we, like the largest slum in Kenya, Kibera, has like 1 million people and it has like 200 NGOs. So I'm not sure if the government has the capacity to monitor
So in Kibera, there are 200 NGOs
yes, approximately.
providing child protection. So
No,
200
providing humanitarian support.
humanitarian, which includes child protection?
Exactly.
Okay, so potentially you have 200 different organizations delivering child protection services.
Yeah, even let's say 100. Let's say half of them
100.
are, yes.
Even 100 is crazy.
Yes, exactly. So you
Wow.
see, this is where my point is: when you have too many agencies, even the government becomes overwhelmed.
Yeah.
And I mean, like UNICEF has really prioritized, and they have a whole thematic area called system strengthening. So trying to strengthen the government to be able to take over the coordination, the leadership. But there are also challenges because if you look at the legal framework, it's also very weak. So in order to strengthen that, we need a lot of legal reforms.
Right.
And one of the key reform is social work strengthening. I mean, to ensure that it's regulated. I think that should be the starting point.
Right. Okay.
Yeah.
That's absolutely fascinating. Is there so I think what you've done is given the audience a glimpse into the complexities of child welfare in Kenya and across Africa, but also anyone from Kenya who's watching might have a better understanding for why their worker is feeling overwhelmed.
Exactly.
Maybe have a lot more empathy and compassion for child protection staff, Kenyan child protection staff. Is there anything else that I haven't asked you? Any other anything else you think is critical or important to mention, say, that you haven't already?
I think maybe just to, this is from my own experience, we interventions should be based on services.
Okay.
So, because in many cases I've seen where we have many children on a case management register, and caseworkers simply don't have an idea of what to do because there are no services. And in my opinion, probably it does more harm than good if you open a case file and you're not able to support the family. Because
So,
the moment you visit a family, you open a case file, you create expectations.
right.
Now, if you're not able to provide the services, then one, they lose confidence in your program because you came, you took time, you opened a case file, and unfortunately, you are not able to intervene. So I think from our context, when you design a case management program, I think it has to be a proper analysis of the services available, interventions and services.
Okay, so I'm going to reframe and use language that I think here in the West people will understand. I think what you're saying, and I'm going to check in with you, is that there's no standardized approach to service delivery. Specifically, there's no framework that's standardized in the delivery of risk assessment and safeguarding work directly with families and children. Is that what you're saying?
Partly, but I'm also referring to a situation where, like I told you, in Nigeria, I think they had, thousands of children out of school. And,
right.
If the government does not have the resources to intervene, the question is, should we open case files for those children? Now, if you visit the family, open a case file, and then you're not able to respond, in future, they won't even trust you.
Yeah. What's
Because
the
you
point?
failed them.
Right.
You failed them. So I think from my experience, people need to be careful. We should not intervene in circumstances where we are not able to.
So you're saying it's it's the former, but it's also make sure you have the resources to back up and support the services that you want to offer or you're saying you're going to offer.
Exactly. And then the sustainability of those services.
Yeah.
Because I've seen cases being terminated because the donor funding came to an end.
Mm.
Yes.
Yeah. It's such a terrible situation of,
Yeah.
I never understood, and you explained it so well today, the complexity of the involvement of donors in your context. That yes, it's a blessing, but it's also a bit of a curse where
exactly.
Yeah.
Because they're not sustainable. And
It's
it's
not
very
sustainable.
difficult to also, some of these cases require long-term intervention. I mean, we cannot make assumption that we will do interventions within 6 months.
Right.
It's case by case. Some cases can be resolved within a month. Some might take a year or more. I mean, it's difficult to define.
Is it fair to say that your hope for Kenya is that there are no donor involvement and it's all government led, properly financed and supported with, yeah?
Yeah, or even if it's donor supported, but I think the support should be
all
channeled
localized.
to the government. Yes.
I hear you. Yeah, that makes a
Yes.
lot of sense. Okay.
Yes.
Well, you've been absolutely incredible, and thank you for sharing your story. You've shed light on so much, and I think whoever is watching this would probably be incredibly surprised to hear what you've talked about, especially if you're someone like me sitting in the West and hearing all the challenges, but you've given it a macro. I've spoken to a few Kenyans who are frontline staff, so they gave me more of the micro, but you've been able to give us more of a broader macro understanding of the impact of how the system is set up and how it's impacting pretty much everyone. It's been absolutely fascinating. Thank you.
Okay. Very much, and pleasure meeting you.
Yeah.
Okay.
So